We'll get that going here too. Just to remind people, bring it up here, that this video discusses matters related to residents of long-term care homes operated by Grey County during the COVID-19 pandemic. Please feel free to share this video with others in the Grey County community. If you have a family member in a long-term care home not operated by Grey County, please do contact that home if you have questions or concerns about their care. So just very quickly, for a format tonight, it will be the same. I will pass it over to Jen here in a moment to give an update. And once she is done, we will open it up to questions and answers. So if you haven't been on one of our Zoom calls before, you'll notice on the bottom are your panel controls, or the top if you're on a tablet device. And one of the buttons is Q&A. So we would ask that you do enter your questions in there, and then we'll do our best to get to as many as we can. So with that, I will pass it over to you, Jen.
Great, thanks, Rob. Let's do a sound check. You can hear me okay? Okay.
I can hear you.
All right, good evening, everyone. Thank you for being here. As Rob said, I'm the Director of Long-Term Care for Grey County, supporting our 3 homes, Lee Manor in Owen Sound, Rockwood Terrace in Durham, and Grey Gables in Markdale. So we met virtually last on May 28th and have been giving updates through the MailChimp each week. In that time, there has been further directives from the province, the Ministry of Long-Term Care, and Public Health. Infection control, staffing, and PPE strategies continue in the homes, and as of today, there continues to be no positive cases of COVID-19 in any of the 3 homes. The purpose of our call tonight is to provide an update and to reassure you that we are doing everything we can to keep your loved ones safe while continuing to color it for them every day. During this call, we will provide updates on the surveillance and detection testing for staff, updates to Directive number 3, which includes the resuming of visits, hospital admissions, some updates on our activities, dining service, Father's Day, hair care, and then answer any questions. So I'll get started. Today marks the 3-month anniversary of the province declaring the pandemic as an emergency. It's hard to believe that 3 months have gone by already. Overall, things continue to be stable in Grey and Bruce and also within the Southwest region. The homes are coordinating surveillance and detection testing as directed by the Ministry of Long-Term Care. Staff are being tested twice per month. This testing is another tool in our toolbox to assist us in monitoring and preventing the virus from coming into the home. We must keep in mind that there continues to be community spread of the virus, and so we must remain vigilant in our strategies to prevent an infection. I'd like to just quickly do an overview of the strategies that continue to be in place. Staff are working in only 1 facility. We're minimizing the movement of staff from home area to home area within each home. All staff in the home are wearing surgical masks at all times. All new residents moving into the homes from the community and the hospital, we'll talk about that in a minute, will be tested for COVID-19 and will also be isolated for 14 days. The leadership teams in the homes continue to provide support and leadership 7 days a week. Plans are in place in all 3 homes to quickly isolate a resident if needed, and plans are in place in each home to quickly move into full outbreak protocol if needed. We continue to monitor our PPE supply and report our inventory to the province a couple of times a week. And we are expecting to receive an order this week that will provide enough surgical masks to support our universal masking for staff across all 3 homes until the end of the year. Directive number 3 from the Provincial Medical Officer of Health remains in place and was updated on June 10th. The significant changes in this revision were around visiting and admissions from hospital. Hospital admissions into long-term care have started again. They were paused, but they have started. And as with admissions from the community, a person moving in from the hospital is required to have a negative test result within 24 hours of the move. And they're also required to isolate in their room for 14 days. This directive also requires that no more than 2 residents reside in a room together. This doesn't impact our 3 homes as we do not have rooms for 3 and 4 people. A guidance document came with Directive 3 from the province titled Resuming Visits in Long-Term Care, and it outlines the phases for reintroducing visits. And it was sent out as part of a MailChimp to give you a heads up, because I knew that that would be something that we really wanted to talk about today. So phase 1 is outdoor visits. All 3 homes have introduced outdoor visits and have sent out a MailChimp outlining the process. These visits are to be pre-scheduled. All 3 homes will be moving to the online booking tool. The Manor is currently using the tool now for scheduling window visits, outdoor visits, and Grey Gables and Rockwood Terrace will go live with the online booking tool on June 25th. And if you're connected with either of those homes, you can expect a MailChimp with some information and details on how that works. Only 1 visitor is able to visit with a resident during the scheduled outdoor visit. And all visitors will be screened before the visit and must attest, confirm that you have had a negative COVID-19 test within 14 days of your visit. Visitors are required to wear a cloth mask that you bring with you. If you forget your mask, the home will provide a disposable mask. And there's also going to be some resources sent out by the end of the week or early next week to support family members in where can you access a mask, how could you make them? So we're putting together those resources. The outdoor visits will happen in designated locations at each home. This allows our staff to fully support the visit by ensuring physical distancing is in place, hand sanitizer is available and used, and the space is thoroughly cleaned between visits. The homes are continuing to support window visits and virtual visits as well. And if you would like to have a group visit with members of the same family or your same circle, your bubble, a window visit would maybe be a better option. It definitely is a better option because the outdoor visits are limited to 1 person at a time as per the directives. Something else to consider when scheduling your outdoor visit is think about how your resident, how your loved one will react, because you have to be 6 feet apart, you have to wear a mask, and depending on the residents, whether they have dementia, do they have difficulty hearing, seeing, is the mask and the distance going to cause challenges? So keep that in mind, and when you call in to or book your visit, if you have specific questions, there's a spot on the online booking to put your questions and someone will get in touch with you, or give the home a call and just talk through what might be the best option. I'm going to go through the other phases just to give you a sense of what's to come. So phase 2A is outdoor visits expanded. So 1 week following the lifting of the emergency in Ontario, the directive will allow 2 visitors at an outdoor visit. Phase 2B, indoor visiting for essential family caregivers only. 1 week post lifting of the emergency. And we're going to talk a little bit more about essential family caregivers shortly. Phase 3, outdoor visiting and indoor visiting expanded. So 1 month after the province lifts the emergency declaration is phase 3. We have very little information in the guidance document about phase 3, and so we are seeking clarity. In the meantime, let's talk about essential family caregivers that are mentioned in phase 2B, 1 week after the emergency is lifted. So the provincial document defines an essential family caregiver as a person capable of providing caregiving support, feeding, social support, and has done this before in the home prior to COVID-19. This person can be a family member, friend, neighbor. In our 3 homes, we will be calling these people designated care partners. A designated care partner is more than a visitor. It's the person who supports the resident in any number of ways, maybe helping with their meal, maybe social support, helping reduce anxiety or responsive behaviors, generally supporting the overall well-being of the resident. This type of support has been happening in long-term care homes for years. We just haven't done a great job of acknowledging this as part of the care plan for each resident. So if before COVID-19, you were in the home a few times a week, had a visit, maybe made your mom's bed, sorted her drawers out for her, maybe fixed her hair, Maybe you made sure the hearing aid battery was working and up to snuff, helped her with her lunch, that kind of thing. You're a designated care partner. There are some silver linings in this very difficult pandemic, and this is one of them. I love that we now have an opportunity to recognize this support as the valued and necessary care that it is. So I don't have a date of when we will be able to introduce the designated care partners into the home. However, I think we need to get started on the planning and the process so that we're ready to go when we get the word. Here's what we're envisioning. The resident or their substitute decision maker chooses 2 designated care partners. Those designated care partners will receive an education package and training on things like infection control practices, PPE use, review of the guidelines and parameters, the commitments and responsibilities of the care partner, the responsibilities and commitments of the home. The homes will work out a strategy to slowly introduce care partner visits based on clinical and public health input. For example, how many care partners can we have in the home at any given time? Those kinds of details we need to sort out. We will check in and evaluate the process as we work our way through it. All of these phases and initiatives will be closely monitored and evaluated and balanced against what's happening in the community around us. If there's an outbreak in the home, we'll need to scale back and go back to no visiting. If there's a cluster or spike of cases in the community, then we need to evaluate, determine the visiting, do the protocols need to be adjusted? Throughout all of this, it's my commitment to keep you informed and up to date and to get your feedback. So it's a two-way street. I need to make sure that I'm keeping you up to date, and I need to hear from you. Is this working? Does it make sense? What do we need to change? So that's a summary of a very challenging logistical situation where we need to sort out how we know it's important to reconnect residents and their families. And we need to do that in a way that's measured and balanced and safe and not too fast, but we need to do it. And so our commitment is that we are working through this process. We'll do it together, and we'll navigate through. I wanted to share some, and I know that there'll be lots of questions, and we'll get to those. I wanted to share some stats with you from the home. So Rockwood Terrace has supported 525 virtual visits, 175 window visits, 1 Zoom funeral, and 1 Zoom wedding. Grey Gables has supported 60 to 65 virtual calls a week, 30 to 35 window visits a week, and has already supported 4 or 5 outdoor visits today. Manor has supported over 150 window visits and have 86 residents regularly signed up on their Color at Connection program. Staffing levels remain stable, and I never miss an opportunity to give a shout out to our dedicated and caring staff who are working tirelessly to provide care and service. If a couple of meetings ago we were in the miserable middle, I don't know what we're in now, but we're plugging along. And I know in the homes there's a concerted effort to be sure that we're able to honor vacation requests, time off, make sure that people are having some sort of a work-life balance, that we know that that's really important. I have a very exciting hair care update. We've just received word that we will soon be able to reintroduce hair care services, formalized hair care services into the home. So stay tuned for some more details on that next week. As we talked about last call, we've been planning for our gradual reintroduction of service. So since our last meeting, there's been a few changes. Dining had been very much affected by the pandemic. So recently there were some changes at Grey Gables right at the beginning, with tables being separated, roommates seated together, and that continues, and most residents are able to be a part of the congregate dining experience. Manor has a hybrid approach to dining. Some residents are in the dining room with the physical distancing, and others are having room service. And they've recently transformed lounges into dining space, and residents are able to eat together, physically distanced, and they're doing this on a rotational basis so that residents are not always having to have room service. Rockwood Terrace who has been doing in-room meal service since March. Because of their layout, and those of you connected with Rockwood will know that the elevator causes challenges. The dining room is kind of close quarters for all of the residents. So they've been doing in-room service. Just this week, they moved on Monday into the first phase of congregate dining, with residents from the 3rd floor going down to the dining room. Transport to and from the dining room has its logistical challenges, but they're working it out, and they're working on a plan for congregate dining for the residents on the 2nd floor. And I know that the residents were really pleased, as were the staff, and that it went really well. Small group activities have been happening in all 3 homes. They are small groups of residents from the same home area and include programs like bingo, cocktails in the garden, crafts, gardening. And we've just started some activities outside with residents from different home areas. These are closely monitored, as it's important to have people physically distanced from each other. There was an outdoor concert at Lee Manor today, and some residents were in the courtyard and some were inside listening with the windows open. There was dancing and shouting out for song requests, and it was really uplifting. Chaplain services vary from home to home, but are happening in either one-on-one, small groups, or with virtual visits. Outdoor time, just time outside, continues to be a highlight for residents, and staff are doing their best to support residents to get outside. On our last call, there was some questions and discussion around how often residents are going outside, or how often are they involved in a program. The program teams in the homes use an internal documentation system called Activity Pro, and it allows them to track resident activity, and it flags residents who have not been involved in a program at least once a week. This helps the teams be sure that they're meeting all of the residents' needs and that no one is falling through the cracks. Keeping residents up to date is also really important. They're navigating through this just the same way we are, and the Ontario Association of Resident Councils provided a communication template for homes to use to be sure they're keeping residents informed of what's going on. All 3 homes are using this resource to keep residents up to date. One home has piloted a bulletin for residents called the Color It Connect Resident Edition, and that's been very well received. Finally, Father's Day. There is so much planned for the men in our homes. Special menus, donuts and fish and chips at one home, men's breakfast and fried chicken dinner at another, special gifts and music. I'm not going to give all the details unless you really want them, and you can ask in the questions, but we'll be sure to put lots of pictures in the next newsletter. So that is my update. Lots of things to update you on, and I know that there will be lots of questions about visiting, so maybe we could go to the questions.
All right, thanks, Jen, for the update. So I think you touched on a few of these. The first question was asking if staff actually get to take summer vacations, and you did ensure that that is happening. So our next question is, it's referencing last update, and we talked about window visits and the idea of an open window visit. Is that something that we are able to do at this time, or were those still closed window visits?
Yeah, so we can open the windows, and in the spirit of transparency, there has been some challenges with people getting very close to each other from the outside visitor and the resident. And so it's just important that if that's something that you want to do, and I think I read that it was at Lee Manor. So when you're booking your window visit, there is a field called notes, and just put a note in the field and that you'd like to have the window opened, that you feel that that will enhance the experience. And the staff will make sure that they have that noted and are able to support that. Because I know we can't have 1 or 2 experiences kind of affect everyone. So we just ask that people keep your distance. I know that this is so hard. And as I said, when you're considering an outside visit, keep in mind the limitations around you, the visitor, will have a mask on. There's going to be a table between you. So For some people, the window visit might be the better option because you can be closer because you each have a phone, so you're talking and can see each other at the same time. I also have heard lots of wonderful stories about grandbabies being held up to the window so you can see the grandbabies closer. And so there may be opportunities where window visits better suit the visit. And then outdoor visits are also available for that one-on-one.
Okay, thanks. So we'll maybe try to stick with the visit side here for a moment. So Kate is asking what the first day is that outdoor visits will start.
Okay, so I did have that information because a couple of the MailChimps went out yesterday and today, depending on the home. So Grey Gables started today. I think they're all starting this week. So Rockwoods are tomorrow. So I have my call a friend feature, and so someone sends me a text to keep me up to date. So thanks, Terry. So the Rockwood visits start tomorrow. Grey Gables started today. And I'll have a quick look for Lee Manor. I know that MailChimp went out today, and I'm just trying to remember when they start. So I'll have a look for that.
Okay, thank you. Someone has commented here that they were looking to book a visit into July, and the system isn't letting them book past the end of June. Is that a known thing, Jen, or is that something that I can follow up with the IT team on?
Yeah, we'll need to follow up with the team.
Okay, yes, that is only 2 weeks away somehow.
I know, oh my gosh. I know I was thinking actually as I was getting ready for the call that the first call we did, it was dark at this time, and we have full daylight right now. So, so I did just get an update that the Lee Manor outdoor visits are starting tomorrow, and that we do know that we can only book the visits 1 week out. So if it's a special situation, taking into consideration traveling, reach out to your home and we can get that sorted out. And I'll do some follow-up to see, I'm quite sure there's a reason that we only schedule them 1 week out, but I don't know it off the top of my head. So I'll reach out and see what that's all about.
Okay, thank you very much. So going back to window visits, just to confirm, do you need to have a negative COVID test if you're doing an open window visit?
No, if you keep your distance, then no, we won't require you to have a test to do the window visit.
Okay. Now there are a few questions here regarding testing.
Yes.
If you want to show that you have had a negative COVID test, what document is it that is required?
Okay, so we have decided to take people's word for it. So there's a lot of steps in place. So you will need to attest. And when you book your visit online, there's a spot where you check, yes, I've had my test and the result is negative. So you're attesting to the fact that test was negative. And then when you come on the day of your visit, you will have to be actively screened. So you'll be asked questions and the question will be asked again about the test, and you'll also have your temperature taken. And so we are taking people at their word. We are tracking the visits. So we're keeping track of the times, the dates. We are actually documenting it as part of the residence documentation, so that if in fact we needed to do any sort of contact tracing back with the support of public health, we would have all of that information. So we are not requiring you to come up with a document to prove it.
Okay. So since there's a 14-day window allowed with COVID-19 testing, is there the expectation that visitors will be required to get tested every 14 days in order to maintain visits?
That is my understanding of the directive as it is currently written. I know that there's conversations happening at higher levels around this directive, but for now, my understanding is yes, you would have to be tested every 2 weeks.
Okay. those are the rules that we must follow as we hear them now. So testing, do caregivers need to be tested 14 days? So we just kind of touched on that. Tests are only valid up until the point of testing. You could contact COVID-19 or any other virus immediately following the testing, and that would not be relevant. That's a good point. I don't think we really have an answer to that, but it's the system that we're working with right now and the directives that we're following.
I'm seeing that that question and comment, and that person has also said, you know, the only way to completely avoid risk is to isolate. 100% that is true. And the best way, the measures that we have, and you were mentioning them here, to mitigate the risk is physical distance, proper hand hygiene, which is washing and disinfecting, and wearing a mask to protect others. And you're absolutely right. Those are the only measures that we have that we know for sure lower the risk of transmission. And you are also right that the test is really only as useful as the day that it happened, because you can have exposure after you leave the assessment center or the testing center. And so I'm glad that you brought that up, because as a visitor, you have responsibilities in the same way that we do as staff to be sure that we are using all of those protective measures that we have at our disposal when we are not at work. And so it's important to consider all of the places as life opens out in around us. We still need to behave in the way that we were 4 weeks ago up until today, right? So we need to wear masks, practice very good hand hygiene, keep our distance from groups outside of our circle, you know, be cognizant of grocery store trips and like if there's other ways of getting your groceries without going into the grocery store, take that option. So those are all really good habits to get into for all of us working in healthcare and all of you visiting into healthcare.
All right, thank you very much. So I see a question again about visiting, coming from out of town, and if traveling a distance, if it could be possible to do back-to-back days over two of the segments. Would you suggest there to contact the home and to use that notes section on the booking form?
Yeah, I would. You know, we have the rules, and the rules are in place to do our best to make sure we have safe practices and that it's as equitable as possible. Having said that, I love to break the rules when it's a matter of the heart, and I'm sure we can find a path to yes. So do reach out to the home, tell your special circumstances, and we'll figure something out.
Okay. Next question. Is there a timeline for massage starting in the homes?
Oh, that's a good question. I'm assuming that it will be similar to the other services like foot care, those types of services. So with hair care coming soon, I feel confident that massage will be coming soon as well. They're opening up in the community, so they'll have guidelines that support them if they in fact were having clinics in the community. So we can use those guidelines to support that transition back into the home. So we'll follow up on that and see where we can go and get that going.
Okay. So speaking of care providers and care partners, could a spouse in a retirement home be designated a care partner for their spouse in long-term care?
That also, I'm glad that question came up. That's something that we are navigating and trying to sort out. And so again, call the home or reach out to me so that I can contact the retirement home, because each retirement home will have their own set of rules and guidelines. And I appreciate that a spouse living in a retirement home doesn't want to risk having to be isolated back in their room because they're a care visitor a care partner in long-term care. So I would love to just say, yes, we can make that work. And I'm sure that we can, but I need to touch base with the retirement home and find out what their rules are. That like they will want to know that their person is masked, that they're physically distanced from other people, that they are not putting themselves at risk and then going back into their retirement home, which is a congregate setting, and putting their roommates and neighbors at risk. So we can work through that.
Okay, thanks. When are phase 2A and 2B being implemented?
I'm just going to scroll back up in my notes here.
Yep.
2A is outdoor visits, so that's starting right away. That's today and tomorrow. 2B and 3. So 2B is indoor visiting for essential family caregivers only. And that's 1 week after the province lifts the emergency declaration, according to that directive. Yeah.
So that one is still to be determined at this point based on provincial announcements that the emergency is declared over.
Yeah.
Okay. Are there any mental emotional therapists for residents in your homes?
Yes, so all 3 homes have social worker services, and there's also chaplain services, and there's also the Behavioral Supports Ontario program, and all 3 of those programs work collaboratively with the activation department, the recreation department. So yeah, those services are available. And the social workers have been really active in supporting the challenges around social isolation.
Okay. So just trying to see, I think there was another one along that vein, but I think you've answered that.
I saw a question about equity and equitable, and also something about ethics. I think I saw a question flash by about ethics. So the visiting guidelines there's been a small subgroup of leaders in the Southwest region, and I've been a part of that subgroup, and they represent hospital, community, long-term care, and patient advisory. And we put together a toolkit of resources to support the planning and the rolling out of the resuming visits in long-term care. And that document was also vetted and input provided by a couple of ethicists. And so another silver lining of this pandemic is the collaboration and integration horizontally across the health system. And so all of a sudden, long-term care and community providers have access to resources that we haven't always easily had access to, like ethicists. Large hospitals have teams of ethicists or specialists in that area. And so it's been really great to be able to use those resources and hear from those experts on fair and equitable, ethical approaches to these really difficult situations. And as for managing the equity of the bookings, the teams in the homes that are supporting the visit programs, they are keeping track and making sure that it's fair and that everyone has a chance, that we can support as many once a week as we can. And then if everyone gets that and there's opportunity for more, well, then we will. But the resources are stretched. The staffing resources are stretched in supporting virtual, the Color Connect program, the window visits, the outdoor visits, and then also trying to keep the small group activities going one-to-one. So the program teams are stretched. We have recruited emergency support workers to support the nursing teams. And then we've also done some training and transitioned some of those support staff to support the program departments to be able to sustain that level of support. because the visits are all supported one-on-one, virtual calls, as you know, often require the support of a staff member. So we're trying to shift resources around to make sure that we can be fulfilling those requests.
Okay, so we have a couple of questions about possible timelines for when a resident might be able to leave the home, whether it's for an appointment, a drive, or just going out for lunch. Do we have any indication about that at this time?
So residents are leaving the home for essential appointments. So for example, you know, if they have a surgery scheduled at the hospital, so those appointments are being arranged and supported. And so family members, the support person is being contacted and those details are being worked out. For a drive and out for lunch, I don't have a sense of when that restriction may relax.
Okay. Can a booking be canceled if a person tests positive after the booking is made? I'm sure we'd be we could definitely do that. Just contact the home and we'll make sure that you get removed from the system. I don't believe it has a built-in feature to cancel an appointment that I'm aware of, but certainly contact us and we would look into that. Are staff still wearing masks? And are there discussions of when this could be phased out?
They are wearing masks, and I don't anticipate it will be phased out anytime soon. I spoke with an epidemiologist from Western who had done a presentation about hospital planning, and I reached out to her because I wanted her to explain her presentation in long-term care terms, help me translate it. And she was very interesting and confirmed that there's just so much that we don't know about there's not a lot that we're able to predict about the virus and the spread. The scientists are still working hard to figure out why one person spreads it to many people and another person doesn't spread it to anyone in their family. Like, it's very random still. And so as the other participant mentioned, what we do know is that masking protects the people around us, physical distancing, which we can't do as a caregiver, but cohorting, keeping people working with the same people. So I don't think masking is going to be phased out anytime soon.
Okay. A question, does Ohip cover the cost of a COVID test? As far as I know, there is not a cost to being tested through the assessment centers. Have you heard any differently, Jen?
No, I don't think that there's a cost.
So we can't answer that with certainty. You'd probably have to contact public health or an assessment center for a definitive answer, but we have not heard of any costs related to it. Kimberly just makes a comment that isolation is leading to depression, decreased cognition, and there's a need for more contact time.
100% agree. And so introducing the designated care partners, even working through the process, I think we will be leaders in long-term care in doing that. And I'm confident that it's the right thing to do, as long as we're doing it safely and in a measured steps. But I think that it's the right thing to do. People need their people. We know that. My 11-year-old went to Collingwood with us yesterday. The other daughter had an orthodontist appointment. And she said, I haven't been out in the middle of the day in weeks. And it was true. She hadn't left the town proper. And it does have a major impact. And we see that. And we want to address that.
Okay. Does a caregiver or care partner have to be the power of attorney?
No. The resident will be the lead in choosing the designated care partners. And if the resident isn't able to make that decision, then the substitute decision maker or power of attorney will make that decision. And there will be more information to come on this, because there's a number of things that you need to consider. You know, even just things like, is the potential care partner, do they work in a high risk area? Like they work in a grocery store or another healthcare facility. what doesn't preclude you from being the care partner, but we will want to make sure that we have done lots of education, lots of discussions about what the parameters are. So there's going to be more information to come to walk us through this process. And we are doing this for the first time. So we'll do it together and figure out the steps.
Okay. So we do have a few comments here of people saying that there's no cost for tests. So that is good to confirm. Thank you very much for that. And we have also been asked if we have been tested, Jen, and what it was like, and I have not.
So I also have not been tested. I moved my office home and have been sticking to home and supporting the homes from here, doing as much as I can of the office work, connection, paperwork, trying to do what I can to support them, because I know the teams are all really busy in the homes. I have heard some stories of being regaled by stories of the testing. So everyone is different. It ranges from, it was a bit of a tickle and it wasn't so bad, to a much more dramatic experience. Not traumatic, but dramatic. So I really think it just depends on how you're feeling when you get there, if you're nervous, and your comfort level. So yeah, I'm sorry, I can't give you my my version of how it is.
How often are staff being tested?
So the directive from the province is to do surveillance and detection testing, and that it is to be offered twice in June. So all 3 homes have done their first offering of it in the last week and a half, and a number of staff have been tested. Around 200 have had the test, and then we will offer it again 2 weeks from when they offered it. We haven't been given an update on July or August, but I am assuming that it's going to be every 2 weeks, making sure that it's at least twice a month.
Okay, thank you. So Katrina's asking if a care partner has is COVID negative and they're wearing a mask, why do they need to stay 6 feet apart for one-on-one visits? So sorry, not a care partner, for one-on-one visits.
Yeah, and that's a great question, and I really think that it's an abundance of caution that the province has made these directives across the province for long-term care homes across the province, and some communities have a lot more COVID positive community spread happening in them, and there's a lot of fear about COVID-19, the virus getting into a long-term care home. So much fear, and this is phase 1, and so I think it's just an extra layer of protection to test it out, make sure that this is going okay, and my hope is that those requirements will start to relax as the province gets opened up more and into a routine of what living in a COVID world is like. So I think that it's the rules set by the province, and so we'll follow the rules and work away at advocating for maybe change as things move along based on what's happening in the community around us.
Okay, thank you. So will a care partner, when they're in the home, will they be allowed to take their loved one out to the courtyard while physical distancing from others that are there, using hand sanitizer and masking?
I think so. Those are specific details that we haven't really sorted out when we get into that the care partners coming inside the home. But I can see that there's benefits to that. And I think if we do what other places have done in the community with, arrows and signage, I think that we can make that work.
Okay, and someone is asking for some clarity on the testing for staff. Is it mandatory, or is it being offered to staff to take this testing?
So it is voluntary. The directive from the province made it really clear that it was voluntary, highly recommended, and it was mandatory that the home offer it and coordinate the testing at least twice in the month. So each home has made sure that it's well communicated, explained as to what the direction is, that it's another measure in us, another strategy to detect quickly and manage the chance of the virus. And they've been offered over 2 or 3 days at each home. Really good uptake from the staff. Having said that, so it is voluntary. We aren't making them do it. Having said that, if there is a positive result in either a resident or a staff member, so we are still doing high surveillance on the residents. Residents are having their temperature taken twice a day. We're watching for all sorts of symptoms. We're isolating immediately and swabbing. And so if in fact there was a positive result, then it's quite likely that public health would have us do a mandatory swabbing of all staff and all residents as a part of the outbreak protocol. So I'm hopeful that answers your question. We are doing our best to encourage it. And then also doing that education piece around safe activity outside of work.
Mm-hmm. Will dedicated care partners be required to be tested every 2 weeks as well?
That will very much depend on the ministry directive. So we'll have to wait and see what the ministry tells us.
Okay. So are we planning for the fall, if the order of emergency is not lifted, to be able to allow some sort of visiting in inclement weather, building some sort of booth in an indoor setting, something like that?
Yep. So right now with the outdoor visits, they are all under a version of a shelter. So either the front porch, the awning at the front of the building. Rockwood had a generous donation from, I think it was the Lions, of some shade tents. So we do realize that if the rain is going sideways, that isn't going to help an outdoor visit. If it's a sprinkle, it probably won't impact it greatly. But we are looking inside, just inside the entryways of all of our homes. Is there some areas there that we could create as designated visiting space? So if in fact the emergency order isn't lifted and we're still doing these kind of physical distanced visits, that they can be inside. So we are looking at that and looking to create that indoor space. And Terry just sent me a text to update. So the West Grey Lions donated the tents or lent the tents. So thank you to them.
Yes, thank you very much. Are staff still having their temperatures taken twice a day?
Yes, on the way in and the way out.
Okay, a question here. When you go for a COVID test, where do you go? To the local hospital or a test center?
I think the best right now, I think the only option is to go to an assessment center. In more urban areas, they have testing centers that are kind of drive-through, and you may even be able to book your test. I don't believe that's the case in the local assessment centers. And you could also reach out to your physician, your family doctor, because they may be able to do the tests. I've heard that in some cases they are, but I don't know if that's across the board.
Okay, and for people listening, in Grey County, our assessment centers are outside of the hospital in Owen Sound and outside of the hospital in Hanover. And if you're over more towards Bruce County, there is one in Kincardine as well. So I'm not seeing any more questions here. If you have anything else, we do have a few more minutes. If you do want to put that into the Q&A section here.
Okay. I thought I might have seen, maybe I misread it, but I thought I might have seen a question go by about resident going to the hospital if they are COVID positive. And I know that we discussed that on a previous call. And so I did reach out and touched base with at least one of our medical directors and also our hospital partners. And so while it's not a part of our routine practice our planned approach for an outbreak protocol to transfer a COVID positive resident to the hospital. That is something that would be discussed, that that's something that was important to you to discuss, that decision would be made with the resident, the substitute decision maker, the medical director, public health, and we would not refuse to transfer someone to hospital. So there is going to be there could be a discussion. I think the question originally a couple of calls ago was around, would we automatically transfer? So we would not, but we could have that discussion, including those clinical experts to help make that decision.
Okay. Well, thank you for the nice comments and the thank yous that are coming through here. Katrina is asking, how long will visits be restricted to 2 visits per week? Do we have an
Sorry,
idea?
Rob, you were kind of cutting. Sorry, you were kind of cutting out.
Sure. So how long will visits be restricted to 2 visits per week? Especially since we've become dependent on video chats and window visits for large families.
Right. So I think that the directive is actually 1 outdoor visit per week. And I don't know how long that will be happening for, how long we'll have that restriction in place. But we will still be offering the virtual connect, the color connect visits and the window visits to kind of supplement if that one just isn't enough. And my call of friends are sending me information. So 1 outdoor visit and 1 other visit is what we're trying to be able to support. And if you would, Stacy is sending out if you have questions about the assessment center, the number is 519-378-1466. And when we send out this information, when we send out the recording through the MailChimp, we'll include links to information about the assessment centers. So thank you, ladies, for that. And we're going to start with the minimum of 1 a week as per the directives. And if we're able to do more, then we will. Our goal will be to say yes to as many requests as we can.
Excellent. So Dale wonders, is there anything that families can be doing to prepare for stage 2 when it's available? Is there any paperwork that they can get started on, anything like that?
So start thinking about who might a designated care partner be for your resident. Maybe start discussing that with your family members, with your resident. The reason that one of the reasons that we are looking at having 2 designated, they would only be allowed to visit 1 at a time and it would have to be scheduled. But the reason we're looking at 2 is that we understand that there needs to be a backup, there needs to be a shared role, there needs to be some flexibility in that. So start thinking about that. Watch the MailChimps if you're not signed up. I'm sure you are, because that's how you got the link to this call. So watch for the updates, and it'll be really clear when we send out correspondence about the designated care partners. I'll make sure that that's all we send out. So this is information specific to designated to visiting. Here are the steps. And that's going to be a bit of a process, kind of working through those first steps. And then there'll be lots of education and lots of interesting things as we work through that.
Okay. And just so people aren't worried that we're starting to crack, when we say MailChimp, we mean the newsletter emails that are going out. That's the name of the program that we use to put them together.
Thank you for clarifying that. Yeah, we get into this lingo, right? And forget that not everybody knows it. And I did just see a question also about confirming, do you have to be the same person visiting the same visitor for an outdoor visit? And no, it can be different visitors, but each visitor needs to have the negative test within the last 14 days.
And that's even if it is the same person coming every time, they still need to have that every 14-day period.
Yes, right now that's the directive.
Okay, perfect. So there is a question here. I don't know that we can really answer it, but it's about people with difficult family situations where there may be a little fractured, and this might be hard decisions for them in choosing their caregiver. Is there anything that we can say on that, Jennifer?
Yeah, and so we talked about that briefly in preparation for this call, and we are really fortunate to work with our social workers. So we work with Age-Wise Solutions, and there's a social worker in each of the homes, and the social worker will help us, and by us I mean the family, the resident, the leadership team, in working through those difficult decisions, and I'm sure that we will be able to find our way through to be able to support the resident, because that's really what it's all about.
Mm-hmm. All right. Well, thank you everyone for tuning into our call tonight. If you joined late, we are going to get a recording out as soon as we can. And like we mentioned off the start, please feel free to share those with other members of your family or other people who you think are interested in these updates. And Jennifer, did you have anything to close with tonight?
I do. June is Seniors Month. And so it's a wonderful opportunity for us to recognize the seniors in our lives, their wisdom, their wit, and very much their resiliency. Our residents are just amazing and helping keep the morale up. They've been through a lot in their lives, and they've got lots of advice and lots of words of wisdom. And if you are on Twitter, follow Advantage, Advantage Ontario, that's the association we're with. And Lee Manor put together a video for Seniors Month that is words of wisdom from their residents. And Advantage Ontario is posting a still picture every day of somebody's words of wisdom, and they're tweeting it out to the world. So have a look there. And I just want to say that it's an honor to support the care and service of the 321 seniors that live in our communities. And remember to turn the news off sometimes, wear your mask, wash your hands, stay safe. Thanks for being here.